Hello everyone, I'm Izhar, Assistant Professor of Pharmacology, Yakad University of Medical and Health Sciences. Today, our today's topic is the drug distribution. In a previous lecture, we had studied the terminologies of pharmacology that was essential to understand the pharmacokinetic concepts. So let's start. Drug distribution. Drug distribution is the pharmacokinetic term which refers to the process by which a drug reversibly leaves the bloodstream and enters into the interstitium like extracellular fluid or inside of the cell like intracellularly to the target site of action. You can see here after prescription dose, pharmacokinetic process starts. So after absorption, drug get distribute through diffusion through various transport processes. So that and for further images, there are so many illustrated images. So we can learn and understand this topic. Before starting the understanding of this topic, I would like to say that this topic is equally important for the pharmacists, MBBS students, and nurses and other healthcare professionals. Drug distribution. After absorption from the site of administration, drugs moves in the blood to different parts of the body. Like before administration in this figure, before administration of the drug, and after administration of drug get entry into the, if we give the drug through IV route, so drug get enter into the bloodstream. So total body, in our body, there is 4 liters of blood. And if we'll measure the plasma concentration of that drug, if drug found in the blood, only found in the blood, so the volume of distribution of that drug will be the 4 liters. Like here, you can see the VD is 3 liter. For example, any protein drug that is given through IV route, due to high molecular weight, it cannot cross the blood vessels or the pores available in the capillaries. So it remain in the blood. So the drug will have the low volume of distribution. As you know, the total body water is 42 liter. If the volume of distribution after calculations comes 42 liters, we can say that that drug has the highest volume of distribution. So it means the drug has capability to cross the blood vessels, capillaries, and it has ability to get into the cells. Like in this figure, you can see the blue dots represent the drug. This is the vessel. So heparin is the example. For example, heparin is a drug which remains only in the blood. So volume of distribution of the heparin will be 3 to 4 liters. And there are certain water soluble and hydrophilic like drugs. So they can remain only in the cellular fluids. So like aminoglycoside, which is approximately 13 liters volume of distribution. So that is moderate volume of distribution. There are certain lipophilic, low molecular lipophilic drugs like ethanol. Ethanol has possess the 42 liters of the volume of distribution. So we can say that ethanol has ability to cross all the barriers, endothelial cells, and penetrate inside of the cells, outside of cells, and also remain equally in the body. So this blue diagram indicates that ethanol has been present in every tissue of the body. So it is important to know the factor affects the drug distribution, because the factors, after studying the factors that affect the drug distribution, we will be able to understand the actions of drug, or we can give the. So we will discuss in later slide the importance of the drug distribution. Here we can understand the factor that affecting the drug distribution. So they are divided into two. First, those factors which are related to drug, like lipid solubility, molecular size, degree of ionization, or the effect of pH on ionization, cellular binding, like receptor binding or tissue binding, DNA binding. So drug interaction is also important factor that is related with the drug. So more concentration, a drug can displace the, we can study later on. The factor related to the body are vascularity, transport mechanisms, blood-brain barriers or placental barriers, plasma binding protein, disease state, and the volume of distribution. Lipid solubility is an important factor. The more lipid soluble drugs can cross the lipid bilayer easily. Like we gave example of ethanol. There are other drugs also, like morphine or benzodiazepines. They are lipophilic in nature. Due to that nature, the lipid soluble drugs can cross every barrier and can reach the brain or somewhere. So they have the large volume of distribution. So they don't need the other facilitation or active transport for their transfer from one compartment to another. Molecular size of any drug, low molecular size is important. Low molecular size can cross the pores available between the cells, endothelial cells. In usual capillary, you can see the endothelial cells have certain pores. So lipid insoluble polar drugs, so they can cross through these pores and remains in the extracellularly, like I gave you example previously, aminoglycoside is the water soluble drug, and can cross these pores and only remain in the extracellular spaces. Degree of ionization has importance, because the like dissolve for example, the drug which has low pH, like acidic drug, will be absorbed from the stomach, or you can see here the HA represent the acid at this pH 7.4. It get dissociate, and dissociated form of the drug that dissociated form, it is very difficult to cross this lipid mucosal barrier. While at the pH 1.4, because the acidic drug do not dissociate in acidic environment, so therefore it can easily reversibly cross from plasma to the gastric juice and the mucosal membranes. Cellular binding refers to the cells, and cells contain certain proteins, lipids, and other molecules. So I have given example here the about the protein molecules, like these molecules blue, pink, and green. Cartoons represent the uh, cellular structures. These are proteins. We can say these are the drug receptors. When drug bind with these extensively bind with these cellular components, so the drug will have the low volume of distribution. Duration of action also has the effect on the volume of distribution. Factor related to body. Factor related to body are so many, but few of them we will discuss. One is the transport mechanism. Is in our previous lecture, we had learned the transport of drug across the cell membrane. There were four types of the transport of the drugs from the cell membrane, like passive diffusion, active diffusion, facilitated diffusion, and receptor mediated transcytosis or efflux mechanism was there. Here, the efflux mechanism is important because so many drugs, if the expression of these proteins, glycoproteins is more, the efflux mechanism will be the more. So drug will be unable to go from one side to another. So the transport mechanism has also role in the uh, uh, in the volume of distribution. Vascularity. Vascularity refers to the vessels, as name indicates, the organs which possess a more number of vessels, or the tissues which are more perfused, get more amount of drug or concentration of drug, like brain, heart, liver, and kidney are the most perfused tissues. So if drug is given through IV, it first drug go to the heart and then brain and kidneys. So the drug get entry into these distribute in these organs more than the less perfused tissues, like adipose tissues or hair follicles or the other parts of skin. So vascularity play also a role in drug distribution. Plasma protein binding. This is most important factor related to body. Like plasma proteins are the albumin, globulin. So if here you can see if drug is if the person is suffering from the hyperalbuminemia, so then what will happen after distribution? There is a protein binding of the drug. So more if more albumin proteins are available in a certain condition, then the lower free drug concentration, then lower will be the drug distribution. And conversely, a low protein binding drugs that will have the higher free drug concentration, and the free drug is able to cross the one compartment to another. So the if a drug has the low protein binding, then that drug will have the higher drug distribution in the body. Blood barriers also play a role, and blood barriers have also crucial role. Like you can see in this figure, these are the tight junctions here. This is the brain capillary, and in the brain capillary is surrounded by the glial cells or the choroidal epithelium. So the purpose of this tight junction is to protect the brain from the toxic materials or the drugs which contain higher molecular weight like toxins. The brain is protected by this blood-brain the blood-brain barriers. So the drug which have the higher molecular weight cannot cross the blood-brain barrier. The drug distribution will be less. Placental barriers, like here, God has protected the fetus from the toxins, as we can see here, blood-brain barrier. There are tight junctions. Here, the blue line represent the endothelial cells. This is maternal layer, and this is fetal layer. So the drug which have molecular formula more than 500 Dalton cannot cross this layer. So disease state like a person if suffering from renal failure will have the less albumin content, and in hepatic failure, the person will suffer from uh, less albumin synthesis. And inflammatory disease, the AAG level will be more, so it will have the more effect. Like if the albumin is less, then the acidic drugs distribution will be less, and in inflammatory conditions, if the AAG level is high, then the basic drug will be affected by the AAG level. Volume of distribution. How to determine the volume of distribution? Volume of distribution is the ratio of the amount of drug in the body that is administered to the concentration of drug in the plasma. So volume of the pharmacokinetic as the name indicates kinetics, the drug is moving in the body, like at the same time absorbed, distributed, metabolized, and excreted. So it is very difficult to determine the volume of distribution, but at the time zero or an steady state, we can determine the volume of distribution. So most of time we call this apparent volume of distribution. Apparent means imaginary or not equal volume, because as we know that it is very difficult to calculate or measure the volume of distribution, as the drug is in constant motion in the body, like absorption, distribution, drug get excreted, metabolized. So here in this figure, we can calculate the volume of distribution. Like if drug is administered 1000 mg in the body, so VD will be, and in plasma concentration of drug is the 50 mg. After administration, after at the time zero or some certain time, we can after half an hour, or we can determine the plasma concentration through different analytical techniques like SPLC, and that becomes the 50 mg. So if these 1000 is divided by 50, then the answer is 20 liters. So the drug has the 20-liter volume of distribution. It means the 1000 mg of the drug has been transferred from the plasma compartment to the another compartment extracellularly or intracellularly. This is very famous figure present in the Lippincot textbook of Lippincot illustrated pharmacology. So total body water is the 42 liters. Intracellular volume is 28 liters. extracellular volume is 14 liters. So by these calculations, if the drug is 28 liter volume of distribution, we can say the drug has entered and intracellularly. If the drug has the 42 liters of volume of distribution, then we can say the drug has penetrated into the plasma, interstitial fluid, as well as intracellular. But there are certain confusions. Volume of distribution of digoxin is about 645 liters, but our body has average weight 70 kg, an average man. It is about 9 times bigger than actual volume. As we have previously discussed, that the imaginary is not actual volume. So that is why this figure comes. So digoxin has the 645 liters of the volume. Why we are studying the volume of distribution? It has importance because it is equally significant for physicians, pharmacists, and nurses. And medicine, which possess the high and low VD values, have a role in the intensive care units. Some drugs need need the loading dose, maintenance dose, like digoxin and warfarin. These are very low therapeutic index drugs. They have low margin of safety. So factor that can affect the volume of distribution can also affect the half-life of drug, loading dose, and determination of maintenance dose and clearance. So in a particular situation where the patient is in a intensive care unit, so the monitoring of these parameter is necessary. And another significance of drug volume of drug distribution is that the volume of distribution is very important to determine the half-life of drug. Here you can see the formula of half-life. Half-life is equal to 0.693 into VD divided by clearance. We can determine the clearance by reversing this formula, or vice versa. Loading dose formula also contain the volume of distribution, like loading dose is equal to the plasma concentration into volume of distribution divided by the bioavailability values. Same is the case with the maintenance dose. So maintenance dose is equal to the plasma concentration multiplied by clearance of drug and divided by the bioavailability of the drug. So we can see here the volume of drug distribution has importance, and it is equally important for all the healthcare professionals to know about the statistics and calculation of the volume of distribution of almost all drugs. Thank you so much for watching this video. For questions, please comment below. I will try to answer the questions. Thank you so much.